Hey, this is Jeremy, and today we're going to be talking about the routes of transmission. And so this is important to understand because if you don't utilize your PPE correctly, that can get you more susceptible to some types of diseases. And so if you understand that disease and how that disease is actually spread, you'll be able to figure out what PPE is appropriate and exactly what it is that we need to do to protect ourselves. So transmission is the way that an infectious agent is spread, whether it be direct or indirect. Now, direct contact, that is when you have a disease or infection that is moved directly from one person to another. And so anytime you have a change of bodily fluids or even blood-borne pathogens, those are all going to be direct contact because you come in direct contact with that pathogen without an intermediate source. So if you have a disease that spreads from one person to another by touching, that is going to be direct contact. Now, an example of this is HIV AIDS. Whenever you have those diseases that are spread through sexual contact, that's going to be a direct contact type transmission. Now, you also have blood-borne pathogens. So this can happen whenever somebody donates blood and is not properly screened. You can have disease transmission there, or even sharing needles for people who may be IV drug users. And then if you reuse a certain piece of equipment, then that can lead to blood-borne exposure that way, and you're moving things from one patient to the next, and that's not necessarily the most beneficial thing. And that you can get infected. If you have an open cut and you get their blood on you, that can lead to some serious issues as well. Now, we also have indirect contact. Indirect contact is whenever you are not going to be in direct contact with that substance, and so it's a spread of infection between a patient with an infection through an inanimate object. And so what this means is that if I were to the object that transmits the disease, that is going to be called a formite. So if I introduce a formite such as a scalpel, I'm just got done delivering a baby, and so we use a scalpel to cut the umbilical cord, and the scalpel has blood on it. So what happens is you're going to have indirect contact via that blood that could be on that scalpel, if you get stuck or you stick yourself or somebody else with that scalpel. And that scalpel is going to be known as a formite because that is the object that the actual infection was transmitted on and from. Now, you also have airborne transmission. Airborne transmission is whenever you have somebody who is coughing. So it's spread through spit, dust, the droplets that we produce, whether it be through a sneeze or whichever. Now, that's important to understand these routes, because if I have somebody who is on droplet precautions, well, then I need to be worried about their bodily fluid that's coming through there. If they're on airborne precautions, then I need to be worried more about what the air that we breathe around each other. And those are really important concepts to understand, especially whenever we're dealing with this. And we can always hand our patients mask or put mask on ourselves, and that's just going to help us protect each other. Now, should you get exposed, whether it be through direct, indirect contact, it doesn't matter. There are things that you need to do to ensure that you yourself are actually protected. And the very first thing is you need to not end patient care, but as soon as you are available, or as soon as it is able for you to be able to transfer patient care to somebody else, you need to wash your hands and wash the affected site of where you had that potential exposure, and you need to wash it thoroughly. And that is absolutely imperative. Now, if you get something that is in your eyes, so you have somebody that spits in your eyes or gets blood in your eyes, you need to flush your eyes for 20 minutes as a minimum, and that's going to be the exact same as what you would expect with somebody with an eye injury from a burn or dust particles or anything like that. You still want that 20-minute minimum eye flush. And you do need to go and get medical evaluation. They may need to draw blood. They may need to do some further tests, figure out what it was that you may have actually gotten exposed to. And if that's the case, they may actually order immunization boosters. And so you may have to get a couple shots. And those are really going to be the big things. And whenever all this is going on, you also need to document how the exposure happened, what you were doing to protect yourself, and how the transition of care went after you got exposed. And so, with all this in mind, keep in mind that we have direct and indirect exposure. Understand how the spread actually occurs and the precautions that you need to utilize to properly protect yourself. And also remember that a formite is an inanimate object that is carrying a disease or carrying contaminate from one person to another. So keep all these things close to knowledge, because these are things that I have seen on tests and you may get tested on. So until next time, that's going to be your routes of transmission and the management.